The UK is closing all its travel corridors from Monday as concerns grow about new variants of the coronavirus. Anyone arriving in the UK will have to present a negative test and will still have to self-isolate for up to 10 days. The new border restrictions will be reviewed in a month's time. It comes as the Prime Minister urged people to stay at home this weekend, with hospitals across the UK under extraordinary pressure. More than 37,000 people are currently being treated for coronavirus, a record number, with the peak not expected for another 10 days in most places. A quarter of the patients are under the age of 55. Tonight, hospitals in Nottingham and Newcastle, amongst others, are standing ready to accept intensive care patients from London to try to ease the pressure on the worst-hit areas. But the Prime Minister said there was hope, with more than 3.2 million people already vaccinated in the UK. Here's our health editor, Hugh Pym.
This hospital was one of the first to fill up with seriously ill COVID patients last March. Now the same thing's happening again, only more so. Like many other hospitals in the southeast of England, Northwick Park is under severe strain. Because of pressure on critical care units like that, hospitals in Nottingham have been asked to take COVID patients from London and the southeast, and Newcastle is also set to receive patients from further south, even London. Trust leaders say hospitals around England have been asked to help by boosting capacity. Some hospitals in London and the southeast of England are so stretched that patients are having to be moved hundreds of miles for treatment. Does this not suggest that not enough was done by the government to prepare the NHS for the second wave?
A huge amount was done to prepare the NHS for, and has continuously for the last year, and actually even in London, where the situation has been toughest, the London NHS has been under huge pressure, but they really have been coping magnificently.
A social media site has brought together impressions from the NHS front line. One doctor said, as he died in the hospital bed all alone, I held his hand, saying everything was going to be okay. I realise now that me saying those things was more for me than for him. Another entry said, I became an A&E nurse because I feel like we make a big difference to our patients, but with this virus we don't get that. Another doctor reported, my grandparents both died of COVID 5 days apart in different hospitals. Seeing all this loss and suffering at work is so much harder when I've been on the other side of it as well. Admissions to hospitals like this one in Kettering involve patients who got the virus a couple of weeks before. As for new cases, there are tentative signs of a change of direction. Recent case numbers show in the last week Northern Ireland, Wales and Scotland have all seen case numbers fall. It's the same in England, with more cases in a bigger population, including dips in hotspots like London. But in some council areas like Knowsley, Halton and the Isle of Wight, there have been increases. Officials believe the peak of infections may have passed in some areas, but not hospital admissions.
It takes a while between people first getting infected to getting ill enough to go to hospital. So that peak will be a bit later in every area of the country, a bit later than the peak of infections. And then the peak of deaths, unfortunately, is a bit later still. So the peak of deaths, I fear, is in the future.
A decisive reversal of those trends may only come once there have been widespread vaccinations. But progress is being made, with the daily total now hitting 300,000 for the first time.
So the UK's borders are being tightened from Monday morning, but for how long and what impact will it have? Here's our transport correspondent, Caroline Davis.
While most of us are being told to stay at home, today saw another announcement about international travel. Yesterday, passengers from South America and Portugal were banned from travelling to the UK to stop the spread of a new COVID variant from Brazil. Today, the Prime Minister announced another measure to tighten up travel.
To protect us against the risk of as yet unidentified new strains, we will also temporarily close all travel corridors from 0400 hours on Monday.
Today's announcement is not a travel ban, it's about quarantine. Combined with earlier policies, it now means from Monday, anyone travelling to the UK will have to show they have a negative COVID test less than 72 hours before they depart. When they arrive, they must now quarantine for 10 days, no matter where they've flown from in the world, or pay for a COVID test on the 5th day. If it's negative, they can leave quarantine early. As well as airports, the policy applies to the Eurostar and seaports, but won't apply to anyone travelling within the UK or Ireland or to some jobs like hauliers. The government say that this step is now needed because it's difficult to predict where new variants might come from. Passenger flights are already significantly down. Heathrow Airport handled just over 1 million passengers in December, down nearly 83% on last year. There's been criticism that this policy would have been more effective if it had been introduced early summer. The travel industry saw travel corridors as a lifeline. It kept people going on holiday. Today, many say they support the suspension so long as travel corridors can come back later this year. This is one of many travel policies the government have introduced. The question now is whether it will make a significant difference in keeping the country safe.